Good evening, everyone. A very warm welcome, and thank you very much for joining us this evening for this webinar by Action for Pulmonary Fibrosis and the Royal Brompton Hospital. My name is Sharon Clinch, and I am the Education Coordinator at Action for Pulmonary Fibrosis, or APF. And before I introduce our speakers, I'd just like to do a little bit of housekeeping. As this is a webinar, your cameras and microphones are disabled except for the speakers. So please don't worry if you can't turn them on. If you have any questions at all, there's a Q&A box at the bottom of the screen where you can type in your question. But please be aware if you put a question in, it needs a sort of sensitive answer, that everybody will be able to see that answer. So we will have contact details later on where we can perhaps keep a little bit more confidential around the answer, as in an email address where you can put your question. This webinar is obviously about medication for pulmonary fibrosis. And it'll last about an hour to an hour 15 minutes because we'd like to have a chance for questions as best we can at the end. It's also being recorded and it will be available on our website at a later date. So I am delighted to introduce you to our speakers this evening. ILD, or interstitial lung disease nurse, Benedetta Vitri, and ILD lead pharmacist, Shereen Boreland, both from the Royal Brompton Hospital, and has very kindly given up their time in their very busy lives working there to present for us this evening. We also have Dr. Fabri, Dr. Laura Fabri, a respiratory specialist who is in the background really keeping an eye on the questions and, just making sure that we can answer them as best we can. And we will try to answer as many of them as we possibly can. It's also a gentle reminder that this webinar is general information and is aimed primarily at patients and carers, and therefore has been written with that in mind. And we're also unable to answer specific questions that relate to your own individual case and which you should address to your own medical team. We also very warmly welcome Malcolm Dawson. Malcolm is living with pulmonary fibrosis and is very kindly agreed to come on here and share his experience with us a little bit later. So it gives me great pleasure to hand you over to our very first speaker, Shereen Boreland.
Thank you, Sharon, for the introduction. So my name's Shereen Boreland and I'm one of the interstitial lung disease pharmacists working at the Royal Brompton Hospital. Today, we're going to talk to you about some of the medications used to treat pulmonary fibrosis and interstitial lung disease. We're going to start by talking about antifibrotic medications, and these are medications that we use to help to slow down the rate of your pulmonary fibrosis. We're going to talk about their side effects and management. We're then going to talk about immunomodulatory drugs, and these are medications that work on your immune system to allow it to work more effectively. Again, we'll talk about the side effects and management of these. And then we're going to give you some general advice that you may find useful in managing your condition. So what do we mean by antifibrotic medications? So there's two medications currently available. One is called nintedanib, or the brand name is called Ofev, and one is called pirfenidone, or the brand name is called Esprit. But some of you have prescribed this medication, maybe prescribed a generic version of the pirfenidone. So these are not a cure for your fibrosis, but they help to slow down the rate of fibrosis or scarring in your lungs. It's important to note that they don't provide symptom control, so you may not feel any different when taking the medications, but they're working in the background on the rate of your fibrosis. Some of the ways that we can monitor that these drugs are working is looking at stability in your lung function or stability on a CT scan of your scarring in your lungs. The two drugs are equally as effective, and in some cases where you're given a choice, it's normally based on personal preference, side effects, and if one may be favourable over the other, if you had any particular contraindications. So I'm firstly going to talk about nintedanib. So nintedanib, or the brand name is called Ofev, so you can refer to it as either, is licensed in the UK for two things. The first is idiopathic pulmonary fibrosis, or IPF, as it's known for short, or it's its license has been extended in the last couple of years to include progressive fibrosing interstitial lung diseases, also known as PF-ILDs. Now, PF-ILDs are diseases that are characterized by a progressive disease course, and sometimes symptoms of these can be shown as progression on a CT scan, lung function decline, or a progressive worsening in your symptoms. For patients with IPF to be eligible for nintedanib, they need to have a forced vital capacity, which we refer to as an FVC, above 50%. And the guidance for eligibility has changed, and now there is no upper limit on your FVC. Now, your forced vital capacity is one of the measurements that we do when you take a lung function test, and what it's looking at is the amount of air that can be forcibly expelled from your lungs after taking the deepest possible breath. For patients with PF-ILDs, there isn't a requirement for FVC in order to be eligible for nintedanib. However, there must be a proven decline in your condition in order to be eligible. Nintedanib is available in 2 strengths. So the standard dose is 150 milligrams, but there is also a 100 milligram strength. And we sometimes use this for conditions such as if your weight is less than 50 kilos, if you have any pre-existing liver or renal impairment, or if you can't tolerate the full dose. It's taken twice a day with food, and we recommend taking it with breakfast and dinner. And it's important that the capsules are swallowed whole and not crushed, chewed, or opened with a glass of water. If you forget to take a dose and more than 6 hours have passed, it's important not to take 2 capsules together, but instead to wait for your next scheduled dose. Pirfenidone, or otherwise known as Esprit, or a generic version, is currently only licensed in the UK for idiopathic pulmonary fibrosis, or IPF. It's not currently licensed for PF-ILDs, and unlike nintedanib, there is an upper limit for your FVC with pirfenidone. So in order to be eligible, you need to have an FVC of between 50 and 80% in order to be able to have pirfenidone prescribed for you. This may change in the future, and the regulations may allow us to use it for patients with a higher FVC, but currently that's what it's eligible for. So pirfenidone is available as a tablet, and it comes in 2 strengths. One is 267 milligrams and one is 801 milligrams. The dose is slowly built up over 3 weeks, and it's taken 3 times a day. So we recommend with breakfast, lunch and dinner, because taking it with food can help with some of the side effects. And there must be a minimum dosage interval of between 3 to 4 hours between each dose. Again, like nintedanib, the tablet should be swallowed whole, not crushed or chewed, and taken with a full glass of water. And the titration of the dose, you start with a 267 milligram tablet 3 times a day, just 1 tablet, and that's for 1 week. In the second week, it goes up to 2 267 milligram tablets 3 times a day for 1 week. And the third week, you go on to 3 267 milligram tablets 3 times a day. Once you're on the full dose, there is an opportunity, once tolerating the medication, to switch to the 801 milligram strength, which would then mean that you only need to take 1 tablet 3 times a day, which can be helpful in reducing the number of tablets that you need to take. There is an interaction with pirfenidone and grapefruit juice that includes the actual fruit and the juice that can affect the way that it works. So it's really important that if you're prescribed pirfenidone, that you don't take or eat or drink grapefruits or grapefruit juice while on it. So like all medications, there's lots of side effects. So we've just highlighted some of the common side effects of the 2 medications, and Benedetta will go through the management of these in a little bit more detail. So with nintedanib, the most common side effect is diarrhea. It can affect about 60% of patients. It can be managed, but it is quite common. And we do let patients know when starting that that's something that you may experience. Whereas with pirfenidone, the most common side effect or reaction to the medication is that it's a photosensitive drug, which means that you can get a rash on your skin when your skin is exposed to sunlight, or UV. It's the UV rays from the sun really that will cause the rash. So what's recommended is if you're on pirfenidone, that you wear sunscreen of sun protection factor 50 or above when out and about, even on a warm, cloudy day, on any exposed areas of skin. They both can cause a reduction in appetite, nausea, some tummy pain, and they both have the ability to cause liver dysfunction. So it's one of the parameters that we do need to monitor when you're on treatment. So that being said, before you start either of these medications, it's important that we do a blood test. And that blood test is to check your kidney and your liver function, and that's before starting treatment. And then this needs to be monitored at regular intervals as defined by your treatment centre. Blood tests are required to ensure that we can safely prescribe the medication for you, and also to ensure that you're tolerating the medicine well. Like all medications, there's drug interactions between these drugs. Now, before starting any of these medications, your treatment centre, and normally a pharmacist at your treatment centre, will go through your regular medicines to ensure that it's safe for us to prescribe these for you. I've listed some of the common side effects, but this is not an exhaustive list, and there's a number of things that may interact. So pirfenidone, as I mentioned, grapefruit juice, can cause pirfenidone not to be broken down correctly in your body. Smoking can reduce the effect of pirfenidone, and some antibiotics can also interact. I've just highlighted ciprofloxacin here because it's one of the common antibiotics that we may use to treat chest infections. Nintedanib can also interact with some antibiotics. I've listed rifampicin and erythromycin here because, again, those are some antibiotics that we may use, and some antifungals, as well as some over-the-counter remedies. So ibuprofen, aspirin, or diclofenac, these drugs are called non-steroidal anti-inflammatory drugs, can affect your bleeding. So they can increase your risk of bleeding, which is also a side effect of nintedanib. So we generally advise that you shouldn't use these medications with nintedanib for a long period of time because of that bleeding risk. What we advise is that any new medications that you're starting, if it's not prescribed by your treatment centre, even if it's over the counter, that you check that it's safe for you to use, so that we can check that there's no interactions and there would be no issues with that. I'm now going to hand over to Benedetta, who's going to explain about the side effects and management of these.
Thank you, Shereen, and hello everyone. I'm Benedetta, and I'm one of the interstitial lung disease nurses at the Brompton. So when it comes to antifibrotics, one of the best way to manage and counteract the side effects is to ensure that you have a very good and balanced diet. So it's important to eat your protein to maintain your support for your muscles and prevent weight loss. Have your carbohydrates because they are the fuel of our bodies and provide immediate energies. And then have your vegetables, of course, because they're full of vitamins and water. However, when we speak to our patients, we do suggest that they do try and eat their meals favoring protein first, followed by carbohydrates and vegetables. This is because the vegetables will fill you up pretty quickly, and if you end up eating them first, then you won't be able to eat the necessary amount of calories to prevent weight loss. We do recommend having 3 good meals a day, intervalled by snacks in between. Examples of what to eat, for example, you could have for breakfast some porridge or cereals with fresh fruits, alongside eggs on toast or toasted bread and crumpets with butter and jams. For your lunch, you could favor something like soup with a sandwich, or even a cooked meal with fish or meat, followed by bread or rice and vegetables. And then in the evening, you could have a pie or something different like a jacket potato, meat with vegetables, or tuna and beans. So how do we manage most of the side effects? First of all, the nausea and the sickness. As we said, it's really important to have your medication on a full stomach, and this is because the nausea and the sickness will be really well controlled if you do have them after a good meal. However, there are situations where even eating enough would be not sufficient, so you could try to vary the type of food, and also using something like ginger tea or ginger biscuits that we know are helpful with the nausea. Other patients have reported that eating little and often was quite helpful and beneficial, or even having cereal bars or protein bars was helping with managing the nausea and the sickness. However, if none of these methods works for you, you can even consider discussing with your team to have anti-sickness prescribed. The diarrhea is that type of side effect that can be quite subjective. In certain cases, simple changes to the diet can be efficient. In others, the patients would need to use loperamide either on a regular basis or as and when needed. There are also certain type of foods that can trigger your diarrhea. For example, spicy foods, fried foods, or food with high fiber content. So favoring white bread, white rice, or reducing the amount of fiber that you eat on a daily basis would be one effective measurement of managing your diarrhea. However, if none of this works, again, consider using loperamide and discuss with your team if necessary. Weight loss and lack of appetite. This is something that can be caused simply as part of your pulmonary fibrosis, but also it's very commonly reported as side effects of antifibrotic treatment. So we do suggest that you do monitor your weight on a regular basis. And as we said earlier, try to favor your protein in your diet to make sure that you're preventing a quick and fast weight loss. And if you do notice that despite eating and drinking as usual, you're still losing weight, you speak with your medical team so that a referral to a dietitian can be promptly done. And also you can be prescribed some fortified drinks to prevent further weight loss. And then finally, the skin rash, as Shereen mentioned, it's something that we can more commonly see with pirfenidone. And we do suggest wearing factor 50 every day of the year and making a habit of it, especially over the summer period, but even during a cloudy day. So just wear it all over your exposed skin and avoid sunbathing during the hottest times of the day, and wear a hat when you're out and about. If you do develop a skin rash, report it to your medical team so that your dose can possibly be adjusted or your treatment stopped temporarily. And if you have problems with itchiness because of the rash, you can apply a moisturizer and even considering using antihistamine. And now I'll hand it over back to Shereen.
Thank you, Benedetta. So we're now going to talk about immunomodulatory drugs. So what are these medicines? So these drugs help to reduce the inflammation in your lungs and help to dampen down the overactive parts of your immune system. They're used to treat different types of interstitial lung disease, and I'll explain some of the common oral treatments. There are some IV treatments that we also use, but this presentation is going to focus on the oral ones. So why do we use these medications? We use them to minimize and manage any potential complications of your interstitial lung disease, and the aim is to improve and prevent any deterioration to your quality of life. Unlike the antifibrotic medications, these medications do provide symptom control. However, it's important to note that it may take a few months before you feel the benefits of treatment. The choice is dependent on the type of interstitial lung disease that you have, and your team will discuss the most appropriate choice for you and your condition. So prior to starting treatment, we do require some blood tests. So because these medications work on your immune system, they can make you more prone to infections. So before you start treatment, depending on what medication you're using, we will need to screen for any previous or pre-existing infections, which include TB, hepatitis B and C, HIV, as well as checking if you've previously been exposed to chickenpox or shingles. It's recommended that you're fully vaccinated before starting treatment if that's appropriate for you, and the recommendations are COVID, shingles and the flu vaccine prior to starting. We do require blood tests before starting, and in the blood test we're looking at your full blood count, which are your white blood cells and red blood cells, as well as liver function and renal function. There will be some monitoring that will be done during treatment. So we're looking at your renal function, your liver function, and your full blood count during treatment. And the monitoring will be more frequent when you first start your treatment, and then the frequency will decrease over time. And the blood tests are really important to ensure that we're prescribing the medication safely for you and that you're tolerating it at the dose prescribed for you. So the first medication that I'm going to talk about is prednisolone. So prednisolone is a type of steroid medicine. Now it may be that you're started on an IV steroid first prior to switching across to an oral steroid. The oral steroid of choice is normally prednisolone, but in some cases we do use another steroid called hydrocortisone. So prednisolone is taken with or after food, and that is to help with some of the gastro side effects. It's really important that if you're on a long course of steroid that you don't abruptly stop it. Instead, this is weaned, and this wean is normally done quite slowly over a number of weeks as defined by your treatment centre. Often you'll be prescribed bone and stomach protection whilst you're on steroids, and that's to help to counteract some of the side effects. And when you're dispensed steroids, you'll be given a steroid card, which is quite important because it shows other healthcare professionals that you're on steroids, as well as giving you general information. And there's a number of side effects with prednisolone. Some are short-term, some are longer-term. So some of the short-term side effects may include weight gain or mood changes, increases in your appetite, and some of the longer-term side effects could include sleep problems, headaches, diabetes, or problems with your blood pressure. Now, your team will be able to manage these side effects for you, but it's important to note that while you're on treatment, you may experience some of these, and that's quite common. The next few medications that I'm going to talk about are sometimes referred to as steroid-sparing medications. What this means is that if you're prescribed these medications and you're also on a prednisolone or hydrocortisone steroid tablet, there may be a possibility to reduce the dose once you're on the full dose of these medicines. But again, this is very individual and your team will explain and decide if it's appropriate for you to do that. So the first medicine that I'm going to talk about is methotrexate. So methotrexate is commonly used to treat sarcoidosis. It's taken as a weekly tablet, normally in tablet form, and that's taken on the same day each week. We often give folic acid alongside methotrexate, and that's to help to reduce some of the side effects of methotrexate. And the folic acid is taken as a weekly dose normally and mustn't be taken on the same day as methotrexate. So what we often say to our patients is to take your methotrexate on a day of the week and take your folic acid the day after so that it's easy to be remembered. So as I said, it's normally prescribed as a tablet, and when we do use tablets, we use one strength of tablet, which is 2.5 milligrams. However, there is a pre-filled syringe which can be administered via subcutaneous injection, which is an injection underneath the skin if you develop quite bad side effects to methotrexate. It's an option which tends to be better tolerated. When you're dispensed methotrexate for the first time, you'll be given a methotrexate booklet. Different hospitals may administer or give you different booklets, but there is a standard methotrexate booklet which you can use to put in your blood test and also gives you general information about it. Like all medicines, the methotrexate has side effects. Some of the common side effects are gastro-related. Taking it with food can help with some of those. Mouth ulcers have also been reported, and minor hair loss and thinning has been reported. But just to note, we do use low doses of methotrexate, so it's not very common and tends to be reversible on stopping the medication. The next drug I'm going to talk about is mycophenolate. So this is given as a tablet, capsule, or there is a liquid available if you do struggle to swallow tablets or capsules. It's taken twice a day, and again, we recommend taking it with food, and that is again to help with some of the gastro-related side effects. The dose is slowly increased over a number of months, as is methotrexate. If I didn't mention that, it's built up over a number of months. And mycophenolate should be swallowed whole. It's important not to crush or chew if you're prescribed the tablets or the capsules. So gastro-related side effects are common, as with most of these medications that I'm going to mention. And it's important to note with mycophenolate, there is a slight increased risk of skin cancer. Although this is very uncommon, we do advise patients prescribed mycophenolate to ensure that they wear sunscreen and regularly check their skin for any new spots or any changes to any pre-existing freckles or moles. So azathioprine is usually given as tablets, and with azathioprine, we normally give this once or twice a day. Again, we recommend taking it with food, and the tablet should be swallowed whole and not crushed or chewed. The dose is slowly titrated, as with the others that I've mentioned, over a number of months. And the main thing to note about azathioprine is prior to starting treatment, we do take a blood test, and we're looking for a specific enzyme in that blood test. And the presence of this enzyme is important because that will ensure that you're able to tolerate the medication and not get quite bad side effects with it. So if azathioprine is recommended to you, what your team will do is take the it's called a TPMT level. They'll do that blood test first. We need to wait for that blood test to come back to ensure that it's safe, and then azathioprine will be prescribed for you. So side effects, again, you guessed it, gastro-related side effects, very common. Also, azathioprine can cause sensitivity to the sunlight. So again, recommending putting on the sunscreen if you are prescribed azathioprine. Hair loss, again, has been reported, but isn't very common, and again, is reversible on stopping the medication. Okay. And the last medicine that I was going to talk about is hydroxychloroquine. Now, hydroxychloroquine may be prescribed on its own, or it may be used in combination with one of the other medications that I've spoken about. It's available as a tablet, or there is a liquid available if you're unable to swallow tablets. What's recommended with hydroxychloroquine is that you have an eye test prior to starting treatment, and that's because there is a risk that it can cause retinopathy in your eyes. Therefore, we advise that you have a baseline eye test before starting treatment, and if you're on treatment for more than 5 years, it's recommended that this is monitored every year. Now, with hydroxychloroquine, you start on the full dose, no dose titration is required. And it tends to be a very well-tolerated medication, although side effects are possible. Most patients do tolerate this very well. Skin rashes are associated with exposure to the sunlight. So again, factor 50, sunscreen if you're prescribed hydroxychloroquine. There are some gastro-related side effects, but again, not so common with this one. And there have been reports of patients saying that they can get tinnitus or ringing in your ears with hydroxychloroquine. If that does occur, it's important that you let your team know. And we have found that when stopping the medication that does resume back to normal. I'm now going to pass you back over to Benedetta to talk about some side effect management and also give you some general advice.
Thank you, Shereen. So, as Shereen mentioned, the majority of the side effects are, again, gastrointestinal related. So the advice in terms of managing nausea and sickness still stands. Taking your medication on a full stomach would be the best option. Change the type of food that you're taking your drug with, and also making sure that you have ginger tea, ginger biscuits, or even considering anti-sickness if the nausea and the sickness are still not controlled. With the diarrhea, same advice. You can consider loperamide. You may know it as Imodium, and you may need to use this regularly to manage the ongoing episodes. And obviously try to avoid a type of foods that would trigger the diarrhea, such as spicy food and a high fiber or fried foods. And then obviously with this factor 50, this is even more important than with pirfenidone, because as Shereen mentioned, there are certain type of medications that can cause the skin cancer. So be very thorough with your factor 50 every day. Make it a habit out of it. We tend to say add it to your beauty routine in the morning. Avoid sunbathing and report to your medical team adding any sudden changes or new spots on your skin. With the immunomodulatory medications, however, there is also the increased risk of infections, and there are a few things that you can do to try and prevent that or minimize the risks. First of all, you need to try and avoid close contact with people that are presenting infective symptoms or that you know are currently having an infection. Thanks to COVID, we've all learned the importance of washing our hands regularly and carry alcohol gel with us, so please keep on doing that. And because of the risk with mouth ulcers on certain medications, we do suggest to keep your mouth clean and brush your teeth regularly so that you can realize any changes and report any problems with the ulcers to your team. Stop smoking should be a general advice. Everybody, that even people that don't have lung conditions, should stop smoking, even more so if you are having a lung problem. But because we know that smoking can also impact on the way your body processes certain medications, you should definitely try and give this up. If you need more help, speak with your team. And if you notice that when you are on these medications, you're having ongoing problems with recurrent infection, it is important to notify your medical team, because it might be that your current treatment needs to be adjusted or the dose changed or the treatments that changed over. So one of the common questions that we get during our clinics is, what should I do if I end up missing one of my medications? So if you miss a dose and more than 6 hours have passed, then do not double up. Skip that dose and take that following one when it's due. However, if less than 6 hours have passed, then you can take your medication as soon as you remember. But obviously, what happens if you end up taking too much of your medications? Well, simply you'll end up potentially experiencing more side effects. And so if this is the case, please report it to your medical team. Or if this is happening out of hours, contact 111 for advice. It is also important that you notify your medical team if you start any new medications. Like Shereen mentioned earlier, there are a list of interactions between different drugs. So it is important to make your medical team aware so that it would be safe for you to start the treatment and make sure there are no interactions. When it comes to getting your medications prescribed, there would be two different options. For antifibrotics, this will be always prescribed by your specialist center, and they will be always delivered by a home delivery service free of charge. However, for the immunomodulatory medications, the treatment can be prescribed and will be prescribed by a specialist center at the beginning, and then potentially moved over to a home delivery service, again managed by your specialist center, that will be still free of charge. There are situations where your treatment is initiated by your specialist center, and then it is moved over to your GP with a document that we call shared care agreement, which provides the GP all of the information and the details on how to safely prescribe and monitor this treatment. If you're getting your medications via your GP and you're not eligible for your NHS free prescription, then you will have to pay the prescription charge. And the best way to pay for this, it would be with a prepayment certificate. And you can find more information about the certificates on the NHS websites. As you've probably been told many times, all the drugs and many of the drugs can affect your liver, and so does alcohol. So when it comes to the medication that we discussed today, we do recommend sticking to the 14 units per week recommended by the government. If you need more information, you can find them on the drinkaware.co.uk website. When it comes to starting a family, the immunomodulatory medications specifically would have some indications and contraindications. First of all, mycophenolate and methotrexate. If you are prescribed these drugs, then you should avoid pregnancies and breastfeeding, and conception should be avoided for at least 6 weeks after discontinuation of therapy. On the other hand, azathioprine, hydroxychloroquine, and prednisolone are safe. However, you would need appropriate counseling, and so it's important that if you're planning on starting a family, you inform your medical team so that this can be discussed further. One of the recent guidelines from the British Society for Rheumatology advised that if used by male patients, all of the drugs that we discussed, so mycophenolate, methotrexate, azathioprine, hydroxychloroquine, and prednisolone, would be safe when trying to conceive. However, once again, we do recommend speaking with your medical team because it would be important for you to have appropriate counseling and plan ahead when you are on these medications. When it comes to the antifibrotics, there are not enough data with regards to breastfeeding. Pregnancies, we know, should be avoided on both nintedanib and pirfenidone. And for the breastfeeding, given that the lack of data hasn't given us many informations, we do still recommend to avoid breastfeeding if you are prescribed pirfenidone or nintedanib. There are other non-pharmacological supports that you may have been given or talked about during your journey with pulmonary fibrosis. First of all, oxygen. There are different types of oxygen and different types of prescriptions. You may have been told about ambulatory oxygen, so it's something you need to use only when doing activities, or not overnight oxygen, also known as nocturnal oxygen, which is something that you would use when you're sleeping, or oxygen referred to as long-term, which means that you would need to use it most time of the day or 24/7. For all of these types, you would need to have an assessment and have ongoing reviews with your medical team to ensure that your prescription is up to date and meets your needs. You need to consider oxygen as a medication, so it's really important to stick to what you've been recommended and advised to use so that you're not developing complication from using it too frequently or less frequently than advised. Pulmonary rehab. This is referring to classes arranged by physiotherapists where you will be explained and advised on exercises that will be tailored to your needs, and they will aim at improving your exercise tolerance and shortness of breath. The course can be arranged either weekly or twice a week on an 8 or 12 weeks basis, and it can be repeated twice a year. There is on an increased evidence of the long-term benefit of pulmonary rehab. So if you haven't been enrolled yet and you are keen to know more, speak to your medical team so you can be referred to the most local team to you. Palliative care. So as a healthcare professional, we would like to involve palliative care as early as possible in your journey with pulmonary fibrosis. This is because we know they are actually the expert at managing symptoms and improving quality of life, as well as providing psychological support, not just to the patients, but their carers as well. We know that often we refer, when patients are thinking about palliative care, this is linked with the idea of end of life, but we've been trying to move away from that concept and consider them more part of the day-to-day management, especially when it comes to people living with chronic and progressive conditions like yourselves, and also those that are dealing with chronic symptoms and some of them can really impact the quality of life. Support groups are also great because it's that type of help that you can find that is different from anything else that we've mentioned so far. It's because you can meet and connect with other patients and carers that are living on a daily basis with the same issues and same side effects that you're struggling with. And so you may be able to get a different type of perspective on the same problems that you're dealing with. You can learn from others and not only how to manage, cope, and deal with the symptoms and the side effects, but you can also find a connection in other patients and other carers. You can find a support groups either at your hospital or from your medical team, or you can even use the Action for Pulmonary Fibrosis website to find out where is the closest support group to you. And lastly, but not for importance, the helpline. This is something that will provide you direct access to your medical team, either the specialist center or secondary team, or you can even find the helpline from Action for Pulmonary Fibrosis that can provide ongoing support to you and can be quite beneficial. When it comes to travel, there are many patients that are wondering about whether or not they will still be able to travel abroad when they are prescribed or given this or diagnosed this condition. So the answer is yes, you can still definitely travel abroad, even if you're prescribed any of the drugs that we've mentioned today. You need to ensure that obviously you have enough stock to cover the whole duration of your holiday, and it might be advisable for you to take with you a letter or an up-to-date prescriptions in case your questions. If you are on oxygen, you would still be able to travel. However, this may require a bit of planning ahead, as you may need to have a test called Fitness to Fly, and you may need to arrange for you to have oxygen on the flight. If that is the case, there are appropriate documents that needs to be filled in, medical forms and arrangements that needs to be put in place. So when you're planning on traveling, if you're using oxygen, inform your team, and we do ask to be given at least 3 to 4 weeks of notice so that appropriate arrangements can be done in time. And obviously, if you're traveling abroad, you need to make sure that you do have travel insurance arranged. If you do need more information regarding oxygen to be taken abroad or travel insurances, you can find them on the Action for Pulmonary Fibrosis website. And this is the end of our webinar for our presentation, and I hope this was clear. Thank you.
I thank you both very much to Benedetta and Shereen for such an informative presentation. I'm hoping you can hear me all right because I changed over to earphones. So if anybody could give me a sign if my voice is not coming over, I'm sure I'll hear very quickly. Haven't heard anything yet, so that's a good sign. I know that Benedetta and Shereen are going to stay with us a little bit longer so that they can help answer any questions nearer the end. So I'd now like to introduce you again to Malcolm Dawson. If you remember, I mentioned Malcolm at the start. Malcolm is living daily as you would with pulmonary fibrosis and is very kindly offered to share his experience with us. Malcolm, are you there? Can you pop your camera on? Lovely. Hi, Malcolm. You hear me all right? Oh, you're still on mute, I think.
Not now, I'm not.
Not now, you're not.
I know,
I know. I thought that was me. Welcome, Malcolm. Good evening.
Good evening.
Thank you so much for joining us. This is invaluable to us, to hear it from, the ground, so to speak, sort of at the rock face, as you might say. Could we begin with you giving us a short history of your diagnosis and the medications that you're currently taking?
Yes, certainly. Hello, everybody. My name is Malcolm. I'm 73 years old and live in Worcestershire. About 7 years ago, I kept running out of breath while I was walking. The doctor came up with the usual thing: you've probably got asthma, to start with. My breathing got steadily worse, and so I was sent to Russell Hall Hospital to see a respiratory specialist. He then decided to ask me to go for a joint clinic with rheumatologists because of my rheumatoid arthritis. They prescribed methotrexate to go along with everything else I was taking. So plod on and we'll see how we go on. Come and see us again in 6 months. I returned and was told keep taking the tablets and come and see us in another 12 months. In the meantime, breathing was not getting any better. On returning to hospital, I was told you've got to have a scan and a lung function test. So I kept taking the tablets until I had to make a lung function test and my scan, but my breathing was not improving or getting any better. Slowly but surely, it was getting worse. I was then asked back for another lung test and another scan in March 2022. On a visit to my doctor, I was blue lighted to the Alexander Hospital. I was in there for 5 days and put on permanent oxygen. I was called back to Russell Hall and told me they were sending my information to the Queen Elizabeth Hospital. My appointment was October the 1st and was told you have progressive pulmonary fibrosis, which you won't get over. But we can give you a tablet that will slow it down. I'm on the 150 milligram nintedanib tablet, and there are certain side effects, which the young lady has already spoken about. And some days they're not pleasant, some days I can cope. I survive by trying to eat sensibly and look out for what I'm doing. Our regular blood tests every month now. It was every 3 months, but now they've decided to retest every month again. But overall, myself and my wife think that I'm a lot better since I've been taking the nintedanib. You have to try and find your own level and stick to it. I know life basically will never, ever be the same again, but we've got to try. We've got to keep going. As the young lady said, you've got to go join a local support group. They were a massive, massive help to me. They've made my life such a lot different that I go now and I join in with the group and help other people who have been told they've got pulmonary fibrosis. And it's a shame because there's so many people with this pulmonary fibrosis that we could get bigger groups still. And we need to. I mean, our local young lady who looks after us, Elaine, she's absolutely brilliant. She does nothing but encourage you to do things and see how you get on. I think that I am talking to others now has helped me massively, and I believe that is probably enough from me for now. I hope that's all right. Not what you want.
Thank you, Malcolm. I think it's very positive that you're on a drug where we heard a lot of the side effects that could be quite concerning for people, isn't it?
Yeah.
The nintedanib. And did you sort of have an informed decision around when you were told about this drug, would you say? Were you given the side effects, and do you feel you had, did you come to that?
I was told at the QE that side effects could possibly be mainly diarrhea or occasionally maybe nausea. But the biggest one is, for me, is the diarrhea. But you have to pick what you're eating. As she said earlier, you have to be very careful on what you choose to eat. And the way I do it is try and eat little and often. I don't go for big meals. I can't sit with a big meal in front of me now, so.
Yeah, I think you mentioned a tea plate size, I think, didn't you? At one point?
Yeah, I try. I mean, my meals now are just a side plate meals. I don't have the big dinner plates anymore, but I find that is quite adequate. And I haven't lost an ounce in weight. I'm still fat as ever.
What, in terms of the symptoms then, you find you're able, as long as you're careful, you're able to manage them, and you can still go about the days that you feel like you want to do things. You can still go about and do the things in a measured way. Would I be right to say it that way?
You would be perfectly right to say that. Obviously, there are days when you don't feel so good. But when on the days that I do feel good, and once I do tend to do things slowly but surely now. Not if I can't do it today, I'll maybe do it tomorrow. And if I can't do it tomorrow, then there's going to be another day. My main aim is to wake up in the morning. Once I wake up in the morning, I can survive the rest of the day. So that's the way I look at it. And that's how I've always been since I had it. Once I settled into the fact of having pulmonary fibrosis, then that was the way we looked at it. My wife is as good as gold. She helps me with it, and she encourages me to do things here and there. And, so as far as I'm concerned, the medication, minor details of any side effects, and it's, as far as I'm concerned, it's brilliant. I'm on nintedanib 150s, one in the morning, one at night. That's besides the other 13 tablets in the morning and 7 tablets at night I'm on. I'm on the hydroxychloroquine, I'm on azathioprine, sulfasalazine, nintedanib, all those sort of things. And they all go matched together. And I have no problem taking them at all.
Yeah, that's really encouraging, because I know that when we see a lot of side effects, that can really take over your head, can't it? And you think you're going to get them all, but in your case, you do quite a lot of things outside too, don't you? That you still try to. The days I say try, you do them. You don't try, you do them. What things are you still able to do in your normal everyday life?
Normal life.
Share some with us.
Well, as normal as it can be now. I like to garden. And I have a show garden. Whereas I used to be able to do 30 hanging baskets in a day, I now do 3 in a day. And if I don't do the 3 that day, they'll be done the following day. I also sing, because I've been told that singing is good for my lungs. I used to be a singer in a band, and I also do solo singing as well. And I help the singing with the Wheelie Different Theatre Company, which is a local group that I was encouraged to join. Again, Elaine, she's the one who encouraged me. She only lives 100 yards from me, I found out eventually. But she is so good with encouraging people, various people, to do different things. And I try and do what I can, as much as I can. I will not just be sitting still all the time. I've got a scooter now, and I nip off to Tesco's and do a bit of shopping. Good lady gives me a shopping list, and I come back with my little bag of shopping and various things like that. So, it's a big help to me. It's massive encouragement. And I've got a wheelchair as well that I put in the car, so it's great. I intend to carry on for as long as I can assure you. I ain't going anywhere.
No, it's so encouraging when, you hear side effects, as you say, and you wonder whether to go ahead and take this drug that says all of these things and so on. And I guess it's an informed choice individually for everyone, isn't it? I know you've said before that this is how you are with it, but it's good to know it's not incapacitating you too much, to be honest.
Yeah, well, each individual person will have individual things going on. You have to manage those individual that individual system for yourself. You know, I can't necessarily tell you how to take your tablets or what to do with your tablets. If you're having a problem with your tablets, then you need to speak to the professionals. Or go to your group and speak to the group. They are there to help. They're not there to hinder or anything like that. You know, that's the way I look at it.
Oh, that's very clear. Thank you so much, Malcolm, because it's this is invaluable to be hearing this experience, I think, and how you've been going along with it as well. And I don't know if there's any questions for Malcolm, and if anybody wants to put them in the Q&A, that I know you'll be staying with us as well till the end of the webinar, Malcolm, so you might be able to answer some of them as well. But yeah, for the moment, that's absolutely brilliant. Thank you. Absolutely invaluable.
Thank you very much.
No, thank you too. And you're getting lots of acknowledgements here, I can see, coming along, swimming along, hearts and all sorts coming up with the value of all these little icons that Zoom now gives us. So we'll now look at some questions and answering some questions. So I don't know if oh yeah, they've come back, ladies. That's good. Well, Shereen's back and Ben's back. That's good. It's surprising how you can feel there's more in the room when you see some people more on the screen, isn't it? Because we can't see all of you who have attended, but you can see us, I hope. We had a lot of questions that were sent through prior, which we invited. But as I explained at the beginning, it's really difficult and we're unable to comment on an individual case because really the individual cases have to be dealt with the people who know your whole history and how it's all going along at the time. But in more generic ways, I think there was a question about flying in one of the questions we got sent before. So hopefully that's answered that. And it's very encouraging to hear that there are ways that you might be able to fly or certainly travel. And we had a question about a lot of the mucus that can be caused through this. Have you got any answers to coping with the amount of mucus that can occur for some people? Is that some way that they can generally manage that? I don't know if either of you, Shereen or Ben. Laura might be in the wings there and answer some of them. Just having a look for our questions now.
So first of all, it's obviously important to define the type of productions. If it's greenish, yellowish production, it's important to speak with the medical team to exclude the possibility of a chest infection. If it's a white, clear phlegm and it's quite difficult to be cleared out of the lungs, then something called carbocystine can help. And again, that can be prescribed by your GP, and it's something you would take 3 times a week. If instead you're troubled with more of a dry cough, the recent research shows that as slow-released morphine can really be helpful in managing the dry cough. And this is something we tend to prescribe for our patients or advise. Or in the past, we've been also advised to use co-injectors. I don't know if, Malcolm, you've tried anything different or if you've troubled with any of this.
I get a cough now and again, but I'm basically just keep drinking water. And I'm phlegm. I've never been one to be able to bring phlegm up. So I just carry on. You know, I just cough and then drink of water and away it goes again.
Yeah. So certainly, like non-pharmacological treatment, like you said, drinking water or having sweets like lozenges and things like that can be helpful. If you've tried, things like that and you're still troubled with cough, then thinking about more medications and active drugs would be the other option.
Yeah, I have got the Oromorph if need be, and I was told that would probably help with a cough, but I've never used it as yet. I'm a bit dubious about using that because I believe you have to inform the DVLA that you're taking morphine, and I don't want I can't have my license taken off me. So my wife's 10 years older than me, and that's the only way we can get about. So, but common sense has to prevail on that one. I'll put up with a cough and so that I can take my wife out.
Malcolm, just to say about the morphine, the doses that we use for coughing are very low dose, and it's fine to drive with the lower doses that we use. Obviously, all morphines can cause drowsiness, so if affected, then that's where they say not to operate machinery. But the doses for the DVLA that you need to inform them are much higher doses than what we use for in IPF coughing.
Thank you very much for that.
That's okay.
Much appreciated.
It's okay.
Every day now, Malcolm, don't you? No, it's thank you. We had a question about, and it might be a little bit to the individual again, but about taking supplements when taking nintedanib. Would that be something that the individual healthcare, if there's supplements care team, would be better advised to answer, or have you got any answers on supplements whilst on this?
Yeah, it really depends on what the supplements are, because I think a lot of patients, definitely, they might be taking sort of supplementary medications, and there are some interactions with nintedanib. I think the problem with supplements is often it's not tested, so we don't have that data to know if there is or there isn't an interaction. But for example, at the Brompton, we have a medicines information service. So what we would advise is any supplements, we'd get our medicines information team to run a full query on them just to check if there is any information available. And if so, then we can advise. So I would just say anything that's supplementary, herbal, vitamins, just check it with your team just to be on the safe side to see if there is any information available.
Makes sense, doesn't it? Completely. Thank you, Shereen. There's a question about preventative medicine. Anything that the question was asked, preventative medicine? Preventative medicine as in, there was no more information, so I'm taking it as in pulmonary fibrosis, but I think it's knowing the cause, isn't it? Without me, embracing on that really, as to knowing how to prevent. By knowing the cause, I guess. Is there any viewpoint that you found come across?
Yeah, I don't know, Ben, if you had a thought on this, but I think it depends on what they're talking about, because I don't think there is any preventative medications available for preventing pulmonary fibrosis. We do use preventative antibiotics and things for preventing chest infections, for example. But for pulmonary fibrosis itself, there isn't anything available to prevent you, especially in idiopathic pulmonary fibrosis, where the cause is unknown. We wouldn't be able to prevent that.
Hope that's going to give some information to ask the question, really. We had one about how you improve an appetite while you're on the drugs. Is it OFEV? OFEV? Excuse my very layman's approach at speaking about that. The person who's asked the question said they'd lost 2 stone, and is there anything, they're on nutritional drinks but no desire to eat. I guess that's a difficult one, isn't it? I don't know if you've got any information that might be helpful. Malcolm might have, or Ben or Shereen.
I think just to say, and to link with what Malcolm said, he's probably eating little and often and not having the big meal that he used to have. And that's one of the main things. Try and focus on what you can and trying to maybe set, achievable goals, even in terms of what you can eat, so that you don't, get upset about the fact that you haven't been able to eat as much as you used to. And definitely linking with a dietitian would be the best type of approach, because she can also give advice in terms of which type of food to favor to make sure that you have enough calories every day and enough nutrients. And obviously, the person is already on supplements. So that's from me. I don't know if you guys want to add more.
I think for me, the only thing to say is only because we utilise our dietitian really well at the Brompton. So we do have a specialist dietitian who works within the ILD team that sometimes I don't know if she'll be able to offer any extra advice, but definitely if your team or your centre has a dietitian and you are struggling with your appetite and food and gaining weight, we would recommend that you speak to your team, so a referral may be helpful for you.
I'm just looking in our Q&A as well. I know they're being answered aside from this, but we've got, I think a lot of the questions, from what I can see, apart from them being individual to the person, are around living with this illness and whether you can do what you can do. And I think Malcolm's, as we've seen in here, you've been mentioned as a great inspiration. And I think that's important to keep your mental health. And that's probably really hard, isn't it? The mental health side of things. So I think, you know, here in the support group is a great place to keep your self-worth and your mental health up, is a really good place to go. One about improving lung capacity or use of the lungs. Is there anything that you can do to improve lung capacity? You mentioned pulmonary rehab, but I don't know if that's how you would address that.
I guess it depends on what they mean by lung capacity. What we tend to say is that for sure we suggest that our patients keep on being active and keep on doing all of the activities that they enjoy doing. And that if you still enjoy going for a walk, you know, for a swim, anything like that, even if it makes you slightly breathless, but to the point where you can recover within a couple of minutes and you never experience lightheadedness or chest pain, then definitely keep ahead and keep on doing that. Then we do recommend, again, you know, pacing yourself or setting up, you know, achievable goals, so that today you might be able to do 1 kilometer, then tomorrow you might be able to do less than that. It doesn't matter, as long as you keep on trying and keep on being active. That's the main thing. And then, you know, treat any sudden changes in your symptoms promptly. So notifying your medical team so that at least we can make sure that you're treated as quickly as possible if that's needed.
And I think just another one that I've just been scrolling through and having a look at what we've been sent. And one other one that's just come to light. And I think you mentioned about going away, but perhaps risks when people are away and they're on holiday. Are there any potential? You mentioned about being very clean, didn't you? Keeping the, you know, any risk of infection. Would that be the primary thing when you're away on holiday that you would suggest people look out for?
Yeah, so there would be situations as well where patients have been prescribed what we call rescue packs. So a course of antibiotics and potentially steroids alongside it to take with them. And, you know, once you've, depending on where you are in your journey with pulmonary fibrosis, you might be able to detect changes and infective symptoms straight away, so that you just need to notify your medical team, discuss with them, and be able to start the treatment even when you're abroad. Obviously, this is a very generic advice, you know, as we said throughout the webinar, everybody's different and everybody should discuss with their medical team. But I guess even going abroad, this would be the first things that comes to mind. Yeah, Malcolm?
I have a rescue pack at home just in case for the weekend I should get a chest infection and I haven't got to wait over the weekend, because normally if I get a chest infection, it's on the Friday of a bank holiday weekend. So you've got the extra day as well. But I've got an emergency pack, and most of the doctors' surgeries, you know, your own doctor will issue you with one of those, just for safe keeping, really. I find that was brilliant. So I think it's a necessary thing that most people should have at home, just in case.
Very reassuring, I should think, as well, Malcolm, isn't it? To have something like that at home. Yeah, just feeling a bit more reassured anyway.
Yeah, without a doubt.
Yeah. So I think there's been quite a few questions going in the Q&A as well. I know have been answered at the time, so there's quite a bit going on in there. And hopefully everybody has got some answers to some of the questions before we draw to a close. We do have a last slide that we can show to give all of our contact details. That is the end of the presentation, which I think we can get it now. That's lovely. Thank you very much. So this is just showing you what support is out there from terms of Action for Pulmonary Fibrosis as well. And there's an email address that you can email in if you've got any further questions, which is under the helpline number on the left as you look at the screen, which is supportline@actionpf.org. And the most important thing as well on top of this is it doesn't take very long, but once you get feedback form afterwards, it's really, really important to us, and we really value what you can put down as feedback in answer to the questions, because that will help us shape these webinars going forward. And it's all about you and what you need, and we need to know that. And so if you're able to tell us, we're going to listen, and that's exactly what we want to do. So that's the most important thing from that side of it. I'll just keep the slide up for a moment longer while we just wind up. And it just remains to say a huge thank you to Shereen and Benedetta and Laura in the background there, who we haven't seen but has been answering our questions, and my colleague Chloe, and not forgetting Malcolm, who you've come on here and just been as frank and as real as what we need. No bells on it, no whistles. It is what it is. You do what you do, and it's actually very encouraging being that real, to be honest. So a huge thank you for the time, expertise and experience. It's absolutely invaluable. So as we draw to a close, just remains for me to thank you all again for attending. I hope you found something in this, or some information, or more questions you might find you need to ask as a result. And just to remind you that the webinar has been recorded and it'll be available on our website in due course. So I hope you all have a good rest of the evening, everybody, and thank you very much, and good night.